Good evening. Thank you for joining the Mono County Coronavirus Community Meeting for April 23rd, 2020. My name is Brian Wheeler, and I'm from Mono County Public Health. I am once again joined by panelists from Mono County, the town of Mammoth Lakes, and Mammoth Hospital. But before we start, I just wanted to remind the public to view the COVID-19 portal, which is in English and in Spanish, and that is located at monohealth.com/coronavirus. Again, that's monohealth.com/coronavirus. You can visit the site for the most up-to-date coronavirus information. You can also submit a question in English or in Spanish via email to our information team. There's also an FAQ page where you could find some of your questions potentially answered. I also encourage you to view the Path Forward Reopening of Mono County, which is located on the homepage of that site. I also want to remind our viewers that if you would like to speak to a nurse just for general information or because perhaps you're having COVID symptoms, you can dial the hotline at 211 and then just select the option for a public health nurse. So let's go ahead and get started. Our first panelist today will be our Incident Command Chief, Frank Freeble. Frank, are you there?
Yes, I think it'd be better at this mute button by now. Good evening, everybody. Thank you for joining us. Just going to cover a couple of quick items so we can spend more time answering your questions and getting on to that. Really, the couple of things I'd like to cover here has to do with some presentation material we provided yesterday to a joint body of our Mono County supervisors and town council members. It was essentially that we're at this strategic turn where we have done collectively some amazing work, both in the hospital and the public health, to prepare our community for patient surge, which we did have at the front end. Excuse me. But it's really been about building capacity to provide care for the people in our community, especially if we had a real uptick that would continue. We still have those things in place, and we need to leave them in place because we will be having, when we return to kind of a more day-to-day lifestyle that we're used to, we can expect the spread of the virus to increase, but at a rate that we can deal with the way we would, not having to do any really crisis type treatments, right? We have done the work to absorb the patients if we have them. So really now it's about how do we go forward and start discussing the pullback, the kind of de-escalation of these very effective social distancing techniques, but they've also really, kept us from having any kind of an economy or much of a life, actually. We've all been cooped up for a while. So really this is about how do we intelligently start going that direction. A couple of key assumptions before we get there, though. We can't get out of the state's stay-at-home order. The rule of law here is that we must follow the governor's direction. He had a press conference earlier this week that made it very clear that we were in line with the state's thinking. We're in step with that, but he himself didn't set any dates, and so we're not going to set dates either. What we are going to talk about is conditions. And the Public Health Office and Alicia Venos with our Economic Recovery Branch have been working very hard this last week, even though work probably goes back about 4 weeks, to match up the conditions that will protect us most from a public health perspective to the realities of running a business. And how do you do that under these conditions? And that's exactly what they've been working on. So that's really where we're at with management of the incident. We have very good capacity to handle support in our community, north to south. We have good capacity in our hospital. We have some really amazing capacity that's been built up just recently in the public health side to manage cases and to really be able to chase down this infection at the individual level and manage it that way instead of broad spectrum like we've had to do here for a good 4 weeks now. So I think I'm going to leave it at that, and then I'll try to answer your questions as we move on to other areas. Thank you.
Thank you, Chief. Our next speaker will be Dan Holler from the town of Mammoth Lakes. Dan?
Thank you, Brian. Dan Holler at the town of Mammoth Lakes. We have engaged in this management of this event since it started, if you will, and working through a lot of different areas. The couple of areas I wanted to touch on, a little kind of on the ground stuff that we're dealing with, and as Chief Freefall was mentioning, we're talking about how do we get ready to open, what happens there. One of the key areas for Mammoth Lakes in our region here is, the outdoors and our recreational environment, and a lot of different things going on through that. Right now, most of the developed areas in recreation are closed. A number of things are under a winter closure, but there's also a number of orders out there from the Forest Service, from the region out of Vallejo, so Region 5, which covers the vast majority of the state of California, that they had all of their developed recreation sites are be closed through the month of April, and then they're going to review those here next week. And how much of that stays in place, we don't know at this point, but that impacts a lot of the areas here around the town of Mammoth Lakes and in Mono County, be it Convict Lake or Hot Creek or into the Reds Meadow area, Lakes Basin, et cetera. A lot of the trailheads and everything in that area, these areas are closed. A lot of different impacts that way. And so the same issue there that they're looking at is how are they ready for an opening? What happens? How do they make sure that their employees are protected, guests are protected? How do they do that in a logical and thoughtful way? And again, they are also following the governor's orders as well. So even if they wanted to open everything up at this point, underneath Governor Newsom's stay-at-home order, they have been instructed to follow that, so they won't get out in front of that order either. So even if everything looks good right here, just at a localized level, we're still under a broader controls, if you will, or dictates from the state level. And so those things really start to drive a lot of our planning as we're looking forward. And I think that really makes it difficult for the summer because we're looking at, the number of events and activities we normally have in Mammoth, and a lot of those will be closed. Some have already been postponed to a future date. We've done that with the town and all of our recreational programs. We have actually postponed them at this point in time, mainly because we're not sure how to bring a lot of kids together in a great fun time and still be able to manage social distancing, be able to manage cleanliness and just interactions that youth tend to have at those age groups. And even our adult programs, a lot of the sporting events, softball or soccer and stuff, again, they're very active. They're very tight quarters for different elements with teams and spectators. So a lot of very, very difficult discussions we've had to have in looking at moving those types of elements forward as well. So a lot of elements closed that way, but again, same thing, looking out past through the summer and beyond, and how do we get creative in our recreational departments, as well as obviously just getting ultimately our landscape opened up, but really trying to sequence through those areas as it makes sense. A lot of other different issues going on, but glad to talk to those based on questions as they come forward.
Thank you so much, Dan. Our next presenter will be the Mono County Health Officer, Dr. Thomas Boo. Dr. Boo?
Hello, everyone. Hope everyone's doing okay. Continue to be very pleased by the lack of new cases. There's just every once in a while now, no COVID-19 cases that I'm aware of in the hospital. Hospital is functioning normally, and Dr. Burrows can tell us more about that. I don't have too much to add to what I said last week, that we don't know exactly when we're going to be coming out of stay at home, but Mono County hopes to be as ready as possible when the governor gives us the go ahead. But it's not going to be going back to life as normal, as everyone has been alluding to. We will want to be continuing to practice distancing and hygiene. Face coverings will continue to be recommended. Currently working with the business community and the schools. Started to meet with the schools about what going back to school in the fall is going to look like in Mono County. There's going to have to be a lot of changes made there. Again, I do feel that we will be ready as a public health department to identify possible cases of COVID and to get people tested and to help them isolate and quarantine as appropriate. But it will require a lot of community buy-in, both personal and community responsibility to protect the community, keep things going and open so we don't have to, move backwards and reinstitute drastic controls. That'll involve people being very careful to stay home from work and school when you're sick. I mean, that's for workers, for parents of kids, and for employers. It's going to be super important for people to take that seriously, and to comply with instructions to isolate yourself if you're sick, or to quarantine yourself if you've been exposed to someone who's sick. Because we're going to be learning to live with COVID-19 for a while until we have, definitive ways to prevent it. I'm happy to take more questions later on.
Thank you, Dr. Boo. From Mammoth Hospital, Dr. Craig Burrows. Doctor?
Good evening, everybody. I hope everyone's safe and healthy and trying to do the best they can to get through all of this. I want to give a couple updates on where we are hospital-wise. First, I'd like to make it clear for everybody, the hospital is open. So from a perspective of the emergency room, our ability to take care of patients in the hospital, our clinics, we are open. If you have questions and you need to get a hold of your doctor, you can call that clinic specifically. You can call the main number of the hospital, which is 760-934-3311, and ask to be directed to that specific clinic. And they can either coordinate a visit, which probably or preferentially will be a video visit, but if you need to be seen in person, that can be arranged as well. As probably most people are aware, the governor at least started to suggest that we can work on planning for doing elective surgeries, which we already have a plan in place and we are working on refining. So when the governor gives us the go-ahead, we can start to do different procedures and surgeries that are scheduled and not emergent. Clearly, everything we're doing right now, surgery-wise, that's either emergent or urgent is going to happen because it has to happen. But I'd like everyone to know, again, our clinics are open, our hospital is open. If you have health concerns or questions, we are absolutely there to take care of you. I'd like to restate our testing criteria right now for everybody, because that's the question that everyone has as well. We are currently in a position where we can test the people based on our testing criteria that we feel need to be tested. Those people are patients that are going to get admitted to the hospital, patients that, or I should say healthcare personnel that have had a clear-cut exposure and there is concern that they have now contracted the virus. And then patients that have been referred by public health for one reason or another. One of those might be because of a tracing where the patient came in contact with someone that's known to have COVID-19, and we're now exploring how many people in our population have been in contact with that person, so we can have a better idea of how widespread across the community COVID-19 is. Along the lines of testing, I want everyone to know that as of right now, we are not doing antibody testing. That does not mean we are never going to do antibody testing. It just means that literally as of today, we're not doing antibody testing. So for us right now, those are the criteria. If you are asymptomatic, we are not in a position that we have enough tests that we can do testing. All of this is obviously subject to change. As our circumstance changes, as our availability for testing changes, as we know more about what's going to be the benefit of doing antibody testing changes, all of those answers or all of those criteria that I just gave you could very well change. And that could be next week, that could be 2 weeks from now, that could be a month from now. Just know where we are right now, and what the future might look like is very likely going to be completely different than what I just said.
Thank you, Dr. Burrows. And before we get into our question and answer segment, I just want to acknowledge that we also have on the line with us CAO Bob Lawton and from Behavioral Health, Robin Roberts. So should you guys have any input to any of our questions, feel free to chime in. So let's go ahead and move to our first question.
Why does the county not have a mask mandate? Community members are mostly wearing masks, but visitors are not.
Dr. Boo?
Yeah, hi. I don't know, thinking long and hard about it, but a lot of, even in the essential sector, people don't seem to be able to make their own masks or improvise, and there's a lot of sort of sense of helplessness, like you're requiring us to wear a mask, then give us a mask, and we don't have the resources to do that. Strongly recommend that people cover their face with, either a nice homemade mask or a improvised facial covering, and Dr. Burrows has made some nice videos that are available on the hospital website, about how to easily make your own facial covering.
Thank you, Dr. Boo. Next question, please.
There was a mention last week of revising the short-term rental restrictions on RV parks. Do you have an update?
Chief Revolt, do you want to take that question?
Actually, for the RV parks, I think I want to see if Bob wants to pick this one up. I know that we had a member of your staff looking at that.
Thanks, Chief. Bob Lawton, acting CAO for Mono County. And yes, our staff are finishing the wording in consultation with our county council and our community development director for RV park regulations that will ensure safety and minimize the spread, but also be respectful of people's desire to be able to park there, use those, or some people for whom that's their primary residence. So we're trying to make sure that we don't come out with something that needs to be pulled back and corrected later on, and is as consistent as possible with other such orders around the state. I think it's going to be very shortly. We'll have that out there, and we'll be able to provide that both to park operators and to park residents and park users.
Thank you, CAO Lawton. Next question, please.
Does Mono County have access to the test that would allow running an epidemiology study similar to what was done by Stanford in Santa Clara County? What sample size would you need to make it statistically valid?
Dr. Burrows, would you like to field that question?
So obviously those areas are much more populous than we are. I guess the short answer is no, we're not in a position to be able to do that type of study. One of the issues specifically with antibody testing has everything to do with how widespread the disease is in our community. And without getting lost in a lot of statistics that frankly I get confused about every time I look at, the less people you have in a community that are infected with something, the more difficult it is to run a test to try and identify people that have been infected and know what those numbers mean as far as saying, you are safe now, you're immune, you can go out. So that population is referred to as the false positive population. So the test says you're positive, you have antibodies, but in reality, you do not. And currently, the number of people that we believe have truly been infected and are immune is so small relative to the size of our population that it would be really, really tough to use that test intelligently and make conclusions to say these people are no longer at risk and these people are still at risk.
Thank you, Dr. Burrows. Next question, please.
When we open up town lodging again, are we going to have any tier type steps, possibly open up to owners and guests for non-TOT rentals for a short period to start and inject some capital into the economy, then allow tourists to occupy after a period of success?
Dan, would you like to field that question?
Yeah, thank you, Brian. We're looking as we open, how do we do a slow and gradual opening? So we are looking at different triggers or ways to manage that. Specifically to open it up to, I'll say non-TOT, that means people would be coming up for more than 30 days to be legally doing short-term rentals. As mentioned earlier, if we look at some of the RV parks where people will drive up and they'll be here maybe for 60 or 90 days is for the whole summer. So that might open up a little differently. But in terms of in the town area, in terms of looking at that, we are looking at ways to slow that opening up. One is for the businesses to make sure they're staffed and have capabilities and be able to meet some of the requirements we believe that'll still be in place for cleaning, for distancing, for protection against the coronavirus. And at the same time, looking at so we're not overwhelmed in terms of visitors. So it'll be a balanced act. We don't have all the details done on that yet, but our economic recovery group is working through that. I think they have some good ideas they're working through. And once they have that laid out, hopefully the next week, 10 days, we'll be able to put that out to folks. People will be able to take a look and see that does that make sense, and then really have that community conversation around that.
Thank you, Dan.
And
Next question.
Brian, I think it's important to let folks know that that economic development group has significant representation and input from our business community, from the very folks who will be responsible for conducting their operations in a safe manner and in a manner that minimizes the spread of any kind of COVID incidents.
Yeah.
So they are part of the process. We're looking to work with the folks who will ultimately be responsible on a day-to-day basis for making this happen.
Yeah, I'll let me note to that too. The representatives on that extend from, the north part of Mono County down through the town and to the south part of the county. So we have good representation of businesses throughout Mono County, not just focused on the town.
Thank you, Dan. Thank you, Bob. Next question, please.
Is 120 being cleared right now? Will they open the highway even if Yosemite is not officially open?
Chief, can you handle that question for me, please?
From reports I had with our cooperators meeting from Caltrain, my understanding was they were going to begin starting the snow removal there. However, as with in any year, the final decision there rests with the National Park Service. I don't know their particular plan for opening, but I do know that speaking with National Park Service here with Devil's Postpile, the Humboldt-Toyabe National Forest, Enya National Forest, and Bureau of Land Management, all of those federal agencies rely heavily on seasonal workforces. And based on their management of the COVID-19 virus and actually the necessity from their organizations, they've made the decision to do quarantine when onboarding. So there's going to be two things that slow down the rate of all the seasonal work this year. It'll be the rate at which people are brought on seasonally to do the work that they normally do. And it will also be the fact that they're going to get all pushed back at least 2 weeks as they go into quarantine and do teleworking and their seasonal startup training. So expect that to run a little bit later than normal. And then I would also like Alicia Venos, I see that she's on. She may have more up-to-date information. I know that she interfaces with Caltrain on some of the other items too. Alicia, can you speak to that?
Yes, I can, if I can. There I am. Yes, as far as I know, Caltrain is preparing to do the normal work that they do on Highway 120. I think that was the specific question. Of course, At the gate itself is the jurisdiction of Yosemite National Park, which remains closed. So I can't say for sure whether the section between 395 and the gate will be reopened when it's safe, but we'll certainly be in touch with Caltrans as to whether they can grant us permission, and the U.S. Forest Service as well. I don't know, Dan, have you heard anything more along those lines?
No, I haven't. I think that's the same information I have. I'm not sure if the Park Service has started anything on the other side. They usually do, but at the same time that Caltrain does from this side. So there may be some work on the other side as well. And Sheriff Braun may have some additional information as well.
I don't believe
So
Sheriff
we've asked
Braun.
Caltrans to not open we've asked Caltrans to not open 120. Sorry, I need to mute my other meeting. Until the travel restrictions are lifted. So, because opening Yosemite to travel is really problematic for us. That will increase our capacity quite a bit, and we can't tolerate that right now. So while they will do road work, because that's part of the normal function, we have asked Caltrans, and they're pretty much on board with that, to not open 120 or 108 or even 89, any of the passes, until we're ready for people to start really moving about the state, not the country. So when the governor lifts the non-essential travel restriction, then we might see the passes open.
Thank you, Sheriff. Thank you, everybody. Next question, please.
County has developed a phased plan to reopen. How is the county satisfying the phase 1 requirements?
Chief Revolt, would you like to answer that question?
I'll start it out. We knew that we would have to have alignment first and foremost, as I said, with the conditions on the ground, which are really going to be clinical, and those were defined in close coordination with the hospital and the public health officer. So I'm going to let them drill down here in just a second. We also knew that it's one thing to have a set of conditions under which we could enter into that. But as soon as we start lifting those, we know that we're a tourism-based economy, and we need to have a plan to have that interface completely with our business community. And so Alicia Venos and her group have also been working with the clinical partners on how they take essentially these items from the medical and public health side and match these up with the business realities for our owners who are having a lot of input on how we do that. So I'd like to turn it over now to Dr. Boo and Dr. Burrows to cover a couple of the specifics there.
Sure. Dr. Burrows has already talked about how the hospital is functioning, and the hospital has developed capacity for relative surge, that we think will be adequate. And in public health, we have the capacity to isolate, quarantine, trace contacts, et cetera, and we have adequate testing capacity for the time being. From a medical, clinical, public health standpoint, we feel like we're ready. We are working with businesses and working with schools, as I mentioned. That's I think the governor's 5th criteria. To try to make sure that there are plans in place to decrease risk when more businesses and when the schools reopen. So working on those things. I feel like as far as protecting the most vulnerable, we have some pretty good programs in place in Mono County to provide food and support to people who are elderly or have medical conditions that put them at higher risk to help them continue to distance, and that should not change when we do have changes in the stay-at-home order. There's some things on the governor's list that are way beyond our control, like having effective therapeutics available. I mean, that's not something that Mono County has control over.
Thank you. Dr. Burrows, would you like to add to this?
Yeah, I think again, this is in broad sweeping terms, but the biggest and most important part of this whole plan is flattening the curve, which thanks to everyone in Mono County for adhering to what we're asking people to do, we have been successful in doing. We had a period a few weeks ago where we saw, for us, a lot of cases of very sick people. And since we have clamped down everything, we have not seen that repeat itself. The important aspect in that, again, from the perspective of what we are going to be able to handle going forward, and I'm going to make up some numbers, but just to give the example, we're on the point of the curve right now that we feel like if we have a sustained reduction in cases, so we right now don't have any cases, and we're comfortable with the idea that we're going to see a couple of cases here and there, even every week, we can handle that much more easily than, let's say we're on a point of the curve where we're going to see 10 cases every week. 10 cases every week is going to very quickly overwhelm our entire system and our ability to take care of everybody that needs to be taken care of. That all has downstream effects with what the town can expect and experience. And if we're in a position that we can take care of everybody and we're not seeing a huge amount of cases, it makes us all feel better about relaxing the restrictions that we are currently under, where we can say, yeah, businesses can open up, people can come here, people can stay here, the town can be busier, more people can be around circulating, and we're still comfortable with our ability to take care of whatever increase we're going to see. And, you know, from a perspective of the hospital anywhere, from a clinic concern, we feel comfortable right now that we're on the part of the curve that we will be able to handle the uptick that we know is going to happen with more people being here. But let me caution that we want to make sure that we're in alignment with all of the town and the county and the businesses and frankly the state, that all happens simultaneously, and we don't just decide to say, Mono County's ready, we don't care what the rest of the state is ready to do, because that's a recipe for disaster, and we don't want to see a major downside to that approach where we're all looking at ourselves and saying, gosh, we opened too early, we shouldn't have done what we did.
Thank you, Dr. Burrows. I believe Chief Revolt would like to add to the conversation.
I have to tip my hat to Bob Lawton here. He said something the other day that was, it was so good I had to include it in the presentation. He made the analogy, says this parachute has slowed our rate of descent. It must be okay to take it off now. And if we do that too soon, we're going to crash this thing. And to Dr. Burrows' point, there's been exemplary work and commitment by the citizens here in Mono County. We're managing this well, but we still need to land it, and we're close. So, you know, we appreciate your patience and compliance. This is not an enforcement game. All of you can outsmart us really quickly. You've done this because you believe in it and support it to your neighbors, and we appreciate it. So hang in there with us a little longer. We will get there. It looks like Dr. Burrows had something.
Yeah, I just want to add, we have people that are much smarter than any of us on this panel have said, this is a war we have got to win. We cannot lose this war. So part of that is having the right strategy to move forward and not foregoing this brilliant battle that we have been under and then lose it in the 11th hour. So this is the hardest part right now, is being patient and understanding the timing is really critical to opening things up and making this work going forward.
Thank you, everybody. I just want to give a reminder that it's just a little bit past 6 o'clock, so we have about 26 minutes left in this community meeting. Next question, please.
Is it true that it's okay to go back and forth from Mammoth to my second house a few hundred miles away?
Dr. Boo, would you like to speak to the governor's orders as far as that goes?
I'm sorry, the question was that somebody feels it's okay to be going back and forth between two houses several hundred miles apart. No, that would not be consistent with my interpretation of the governor's stay-at-home order. Each individual should stay in their primary residence. It would be legal for them to stay in their secondary residence, but they should definitely stay in one residence and not travel back and forth.
Thank you, Dr. Boo. Next question, please.
Can you provide some insight as to how reports of code violations are being handled?
Sheriff Braun, would you like to field that question?
I'll probably let Dan Holler handle it, or Bob, I would think. I don't know.
Okay, Dan, would you
This
like
is
to?
Dan. It depends on what type of code violations that people are talking about. We have a standard code enforcement program in place, so we get things from garbage and left stuff on the highway or other types of code violations. The one that tends to come up the most related to this is really people utilizing rentals. They're doing transient rentals or inviting people up, those types of elements. We do have a full enforcement capabilities on that. We've seen a lot of the number of advertisements drop off. But if people are doing that and they're in violation of the governor's order on that for people staying at home and for the type of workers that are supposed to be at home, then we are doing that type of violation, and that can be reported through the town's TOT site, where we can TOT is the tax that we collect off of that. And so there is information there on the website that can tell you how to tie into that and be able to report any type of a code violation from that perspective.
I'll help out my distinguished colleague by giving the TOT hotline for the town of Mammoth Lakes. It's 760-965-3670. And at the county, we have an email, dedicated email box at COVID-19 violations at mono.ca.gov. So you're covered for the county and you're covered for the town.
And those violations will get reported to community development, and they will sort them out. If it's a criminal issue, then it will be reported to the sheriff's office. We'll follow it up on it. If it's a code violation issue, then community development will follow up on it.
Thank you. And just as a reminder, any unanswered questions, we will be posting on our FAQ page. So make sure you tune into that. So next question, please.
Let's go to our phone-in questions. First up,
Okay.
Jenny. Go ahead, Jenny, and press unmute.
Hello?
Hello, go ahead. What's your question tonight?
Well, first of all, I want to commend everybody at the hospital, the first responders, this forum, all of Mono County for doing their part to try and keep our numbers down. Just a quick question. I might have missed this, just kind of tuned in a while back. On the people that have been recovering from this, what has been their diagnosis? Has it been severe? Have people been moderate with this? How bad have they been dealing with this virus?
Dr. Burrows, would you like to field that?
Yeah, so we have been reporting our numbers dating back to the beginning of March when we started to see COVID-19 patients in our county. To date, and this is going all the way back to March now, I think we've had a total of 5 patients that we've admitted to the hospital. One or two of them, one of them did not actually need to be admitted to the hospital. We counted them as someone that was seen and had to be on oxygen at home. The second one had to spend about a week in the hospital on just oxygen. 3 of them were in the intensive care unit, and of those 3, we did have one person that ultimately passed away from this. That is our hospital experience. And if my numbers are correct, and I apologize if I'm a little wrong, we've had a total of 24 positive cases identified in Mono County. So the rest of those patients have not had to be in the hospital. So our experience has been what we've been hoping for, which is most people that get infected with this virus are at least to the point that they don't need to be hospitalized to be taken care of.
Thank you, Dr. Burrows. And you are correct, it is 24. Next question, please.
Next caller is Monica. Go ahead and unmute yourself.
Hi, this is Monica. I have a question for Dan Holler as the town manager. I was listening into that painfully long meeting yesterday regarding the proposed Inyo road closures, and it sounds like The forest trails will remain open and we'll have access to the Lakes Basin on the paved path, which is great news. But what was alarming to me was hearing you say that the town is considering closing parking at Twin Lakes. I understand there's been some issues with people parking on the road, but I don't think taking away parking is the solution to limited parking that's already a problem. The PD has the authority to ticket violators. So my concern is that we're closing off access to outdoor spaces, and that's eventually just going to crowd more places in town, and places like the lakes, Mammoth Creek Park or Convict Lake. And I think crowding people is actually counterintuitive to what we're trying to do here with public health. So my question is, as a town manager, I'm asking you to commit to leaving parking open at Twin Lakes.
Thank you, Monica. It's an ongoing challenge we have there when the upper gate stays closed. And we see that a little bit in the winter, throughout the winter season. We also see it in the early part of the spring as things open up there. And no final decision has been made there, but if we do end up with problems up there in terms of the amount of parking we have, and if the path is melted out enough and we get bikes up there, one of our concerns is there's a couple areas on that path that tend to be high areas for crashes, and we need to get medics up there to be able to help people. And if that area where that parking is jammed up and you can't get a ambulance through there, for example, and I believe we've had cases where that actually has been the reality. And so we want to make sure that we have that public safety side covered that way as well. Personally, I've experienced you end up there with a one-way road going both directions because the way people park, and so you're going up and down on the same side of Lake Mary Road. So our challenge is, how do we allow for the parking so people can get there, they can walk, they can bike, they can head up there, but also that it doesn't create an additional public safety problem there where somebody else is going to end up hurt, or we're going to end up with other accidents, which then get the right accident up there, then all the cars above the accident, they are going to be there for a while as we work through things. So it's not a done deal one way or the other. I don't know if it pushes a lot of people different places. I know a lot of people walk up the bike path. Your more adventurous type will get their mountain bikes and go up the rock trail and cut across it into some of the other bike trails up there, the mountain biking trails. So there's other access into the basin, so we want people to be aware of that. But no final decision on that, but the real question just becomes is, how do we keep that in a safe area? And yes, the officers can go up and we can ticket and we can tow people, and that just tends to create almost as much animosity as the parking not being there. So it's a tough situation to put our officers in and to put the community in at times. But the goal would be is, how do we expand that out and keep parking? But on the other hand, we can't let it get to a point where we have an additional safety problem.
Thank you, Dan.
Yep.
Next question, please.
Next question is phone-in caller ending in 4508. Go ahead and unmute yourself.
Hi, thank you for taking my call, and thank you for having this panel. Very informative, and we've been following every week. We appreciate it. Earlier in the conversation, you mentioned opening up Mono County too soon and having a problem with that. My question is, what has the county thought about, and or what is the plan if California relaxes the stay-at-home order, but Mono County restricts the rental capacity and or tourism coming to the area? What's the plan for that?
Thank you for your question. Chief Freevold, would you be able to answer that?
I'll do my best. It's an excellent question by the caller. And as you've heard, a couple people were you all using different, terms: delicate balance, right timing, choreography. This is a situation where we're all having a similar experience, medically, public health-wise, economically, and yet they're all just slightly a little bit unique. When we look at the public health demographics for some parts of the state, we look at it and say, wow, we're doing really well in these areas, and we're struggling a little bit over here. Our mobility stats have been really good because people are, really limiting locally here in Mono County what they're doing. So the part of what we're doing is not just making sure that we have this localized capacity, as Dr. Burrows mentioned, to handle more patients if we get a surge, which is still a possibility, to vastly expand our public health contact tracing, which Brian Wheeler and Dr. Boo have been working with. We've picked up a bunch of extra capacity people there to handle that. Another big part is when we look at where does most of our tourism come from. We have a very strong tourism economy, a drive economy from Southern California. So part of it is making sure that we understand not what is just going on in Mono County, but I'm regularly in touch with Quad County's EOC to our north, and Inyo County. I've got a couple different people I stay in touch with down there. We're also looking to Southern California because it's where a lot of our initial tourism is going to come from, especially if airlines are still down. So your question is an excellent one. We're trying to look at the larger picture. We have been for a while just out of logistics, because a lot of the things that we've had to order to get here we're sharing with other people. So this balance, this choreography, this timing, you're spot on. It has to do more than just Mono County. We can't lag behind here if the whole state opens up, but it doesn't make much sense to open up too early if no one's coming either. So we're trying to watch those things and strike the right balance, all things considered.
Thank you, Chief. Next question, please.
Next question is from phone-in caller Daniel. Go ahead and unmute yourself.
Maybe this is me. It's Dan McConnell, actually. This is for Dan Holler again. I haven't heard anything about the possibility of bus transportation in the lake space. And your intent isn't to close the lake space. And am I correct about that?
In the lake space, and the gate would potentially stay closed there for access up through the end of June at the latest at this point. And then assuming that the governor's order is lifted, looking at opening up the basin. The bus service is going to be very tricky. We may not be able to provide the same level of service we have in the past. We're assuming that the distancing standards will be retained. And so if you're looking at the trolleys, the number of people you can fit on there and still keep social distancing in place outside of immediate families gets to be a little problematic. So if we do keep it up, we haven't made a final decision there, but if it continues to run, it will run on most likely a very reduced capacity level. And whether or not we'll do the bike trailers will be a secondary question to have that discussion on, if we're going to haul the bikes up or not. And again, just because of the number of people that you can actually take on any given trolley.
Thank you, Dan. So we've had a lot of questions in regards to Mammoth Lakes. I'm just wondering if we have any questions in our queue that are from other areas of the county.
Yes.
Many events take place outside of Mammoth. Please recognize that Mammoth Recreation Events is not a one-size-fits-all for the rest of the county. Can event organizers submit plans for events to be held safely, including fishing derbies and events in July and August in areas like June Lake, Bridgeport, and Antelope Valley?
Chief Freebolt?
Yes, one of the things that we did when we were working with Dr. Boo in public health, and also Dr. Burrows and the other members on the clinical side, we asked an intentional question, and that was, as we look at these mitigations for really all kinds of different things, essentially it's by business sector, things like lodging, retail, restaurants, etc. But we did ask the question, are there ways that the mitigations can be considered or crafted under different conditions? And so we tend to think of a lot of this stuff by geography, just the way your question is posed. But the truth is we've always been talking about conditions in the same way that we're not going to talk about dates on a calendar. You don't want to put like you say, a one size fits all, or still say that, well, this only applies, in this part of the county or this part of the county. One of the things that the public health officer and economic recovery are doing intensely right now, is taking those mitigations and figuring out how to apply them across business sectors regardless of where they are. And so that is what they're working on right now. To say that those change only based on, say, population density, it'd be inconsistent with anything that we've seen out of the best science and practices from the governor's office. So we're not going to try to do it from a geography basis, but from a conditions and risk basis. And I'd like to give Dr. Boo and Alicia an opportunity to add to that if they have anything.
Go ahead, Alicia.
I don't think I really have anything to add to that, but if this is a specific event organizer who would like to reach out and talk to us, I'd be really interested, and I'd encourage anybody that has some creative ideas, because we're really exploring kind of all aspects of the mitigations. And if you particularly have an idea on how you could run your event sort of semi-virtually, or whatever creative ideas you have, please contact me. My email is avenos, AVENNOS, @mono.ca.gov. Thanks.
Dr. Boo, did you want to add to that?
No, I'm very nervous about events occurring this summer throughout the county, throughout the state, and throughout the United States. But we'll see what the what kind of restrictions the state puts in place. Continues after when the stay-at-home order is lifted, and we'll try to make the strike the right balance between safety and not being overly restrictive here in Mono.
Thank you. Do we have any more questions that are from outside of Mammoth Lakes?
Yes. We're here in North County, have no cases from the information you give us. So when can North Mono County get back to our lives?
Dr. Boo, go ahead.
Well, of course, there is one case in Mono County, and this epidemic is not over. We know that when we do, go back to our lives, as you say, that there will be increased virus transmission. Whether it happens, quickly or over, a period of some months remains to be seen. I mean, there's obviously significant disease spread in northern Nevada and and the urban areas of our neighboring state. So anyway, we're all one state, we're all one county, we're all subject to the governor's stay-at-home order, and so no changes until the governor eases up on the stay-at-home order.
Thank you, Dr. Boo. I believe Chief Revolt would like to add to this. Go ahead, Chief.
Thank you, Brian. Just one quick item that has been really consistent with this virus, and I know you've heard Dr. Burrows and Dr. Boo say this many times, it's hardly we get 72 hours go by without additional information, something that's new or, no pun intended, novel about this novel virus. They do mutate. We always hope they mutate in the right direction. But there were 3 studies that came out at the beginning of the week. I think it was one out of USC, one out of the Bay Area, and a place in Massachusetts. I don't remember right now, but at least the initial indications from those is that the spread of the virus, it had been a lot more prolific in each of those areas than was originally thought to be. We weren't really sure, and you'd heard over and over again people talk about the shortage of testing at the front end of this, and the takeaway message to me was that wow, this has been a lot more present in areas than we've realized, because most people don't have a lot of symptoms or any. And so to say that something is not in a particular community, people a lot smarter than me have looked at it in retrospect and found that maybe it actually had been there. And we just don't know enough about how long it takes to get out of the community yet. So I'd be careful about saying with confidence that it's not there, because that's certainly not something I think that we can say right now.
Thank you, Chief. Do we have any more questions from areas outside of Mammoth?
Brian, can I add to that?
Sure, absolutely.
So this is going to be difficult to express, but as this moves forward worldwide and nationwide and statewide, this is usually the case with a lot of things. We know a lot more about what we don't know than what we do know. And eventually that balance will change to the point that we now know a whole lot about it. But as Chief Freevault was saying, right now we've just discovered a whole lot of information that we did not have a month ago. And that's going to continue to be the case. And in order to be smart about this, I think we all have to have this position that we're not nearly as smart as we think we are. As painful as that is to say, that's the reality. But as long as we recognize that and we don't rush ahead thinking we know what we're doing, then we're going to make the right decisions. We're going to be cautious and smart and recognize there are a lot of unknowns that we're still discovering, and that will allow us to be successful in the end.
Thank you, Dr. Burrows. Looks like we have time for probably one more question. Do we have any more questions from outside of Mammoth Lakes area?
We have one question regarding all of Mono County. Many communities across the state are reaching out to Governor Newsom to let him know that their community is ready to move forward. He has said that he will release areas from stay-at-home order based on the input from these counties rather than the entire state at once. Is that something Mono County will pursue?
This is Tom Boo. I haven't heard that. I don't know if anyone else has.
Chief Freevault, do you have you heard anything about this?
As Dr. Boo said, I've not heard that actual statement. What I will say is that our intent, as Dan Holler said, is over the next 7 to 10 days, without getting too much into the details now, we'll be working on that a lot right now. We want to absolutely minimize the reflex time between when the governor makes the decision to lift those stay-at-home orders. We want to have done all the work here with the clinical side of this incident management and the business recovery side, the economic recovery side. We want to have done all the work ahead of time and allowed people enough of an idea on how to prepare so that the distance between when we get the green light to lift the stay-at-home order with mitigations, it won't just be a light switch, and the time that businesses can start conducting business, we want that to be very, very short. And so that's the way we're setting about this. But to support Dr. Boo's point, if Governor Newsom has said he's going to release county by county, I've not run across that yet.
Thank you, Chief. Well, that looks like we're just about out of time. But before we go, I want to thank all of our panelists, and I want to thank the community as well for maintaining and following the directives of the health officer and the governor. And I also want to remind everyone again about our COVID-19 portal, which is monohealth.com/coronavirus. And again, you can get all the most up-to-date information there. There's a Q&A section. You can submit questions and our information team will get back to you. And it is in English and Spanish. And also, again, I encourage everyone to read The Path Forward Reopening of Mono County. Hope to see you all again next week. Until then, be good to yourselves and each other. Thank you.